Epilepsy. Not all seizures look the same. Zoe is not drunk and she hasn't taken recreational drugs. There are 600,000 people in the UK with epilepsy. That's one person in every 103. And there are at least 40 different seizure types. It's possible for people to have more than one seizure type. The most common seizure is called a tonic-clonic seizure. This is where the person loses consciousness and falls to the ground convulsing. About 60% of people with epilepsy have this type of seizure. The second most common type of seizure is a focal or partial seizure. Zoe is having a focal seizure. This may involve altered consciousness. It's much more difficult to recognise than the tonic-clonic one. About 20% of people with epilepsy have this type of seizure. The first aid required for these seizure types is different. This film will show you how to recognise both types of seizures, what can sometimes happen during or after a seizure, and the appropriate first aid. Focal seizures. In the last film, we saw Zoe having a focal seizure. Zoe hadn't yet felt able to tell her friends about her epilepsy, so they didn't understand what was happening. A focal seizure is when a small part of the brain is affected. The person doesn't convulse and may be able to walk, but may not be aware of what's going on around them. The person may have repeated movements, for example, fiddling with something, repeatedly lip smacking, and their eyes may look unfocused. They are often unable to respond to questions or instructions.
Somebody who's having a complex partial seizure may actually look like they're under the influence of alcohol or drugs, and their behaviour will be slightly bizarre and slightly confusing. But there are a number of ways of trying to recognise a partial or complex partial seizure, and that is that there are what we call stereotypical behaviours. So, for example, a patient might start to rub their fingers along a piece of cloth. They might make smacking noises like this. They will look a little bit confused. They might also respond to verbal communication, but the reality is that they are actually in a state of impaired consciousness. So they won't be aware of what's happening around them.
Zoe doesn't understand what's happening. She is frightened and her instinct is to protect herself. But she is seen as being aggressive and is now in danger of being arrested.
Often some people appear to be aggressive following a seizure. I think this is clearly not the case. What is happening is that during the seizure, the individual is confused. They're confused because their brain is not functioning as it ought to be.
Zoe's seizures usually last for a few minutes, but some people have focal seizures which can last for hours, and even when a seizure finishes, some people can remain in a state of confusion for much longer. This can happen after a focal or tonic-clonic seizure. Ben has woken feeling unwell, but he has to sign on today. As he arrives at the job centre, he has a focal seizure. So he doesn't hear his name being called.
Ben Scott? Ben? Ben Scott? Ben Scott? Ben? Ben Scott?
After a few minutes, the seizure finishes, but he is still feeling very confused.
Can you please leave, sir? Come on, thank you.
He is still confused. He doesn't see the security guard approach, is frightened and instinctively protects himself. The police are called.
And when somebody is approached during a seizure, their natural instinct is to push away. It isn't actually to strike out, and it isn't purposeful, directed behaviour. They're confused and they just actually want to be left alone.
Epilepsy is so incredibly misunderstood.
When I have a focal seizure, majority of mine are at night time, but the daytime ones, quite often I have a warning about this and I can feel a bit dizzy and I feel like a bit of a sickness coming on.
I have this focal seizure and I can't help it.
Sometimes I can feel like the room, not spinning, but sort of coming in towards me a little bit.
It's like you get put to sleep somewhere, you go to sleep in your bed, but you wake up next to a motorway, walking down the street.
Everything's jumbled up.
And your mind is confused and you're very fearful and you don't trust.
Afterwards, I'm still feeling extremely confused and dazed and still wondering where I am.
It's so important in epilepsy that you let it play out, and then when it stops, it'll calm down naturally.
I've no idea if I respond to people that are with me. They'd have to tell me that afterwards, whether I responded to them or not, because I have no idea at the time. I think at the beginning of a seizure like that, I do know there's somebody there, but I don't think I'm able to speak to them or hear what they're saying to me. I'm not in control of that at that stage.
Get the details from the friends or family members.
The advice I'd give to anybody who's with me during or after a focal seizure is, if they haven't found my epilepsy ID card, then to look for that, to find my name and contact number.
Just to keep the person safe whilst it's happening.
Tell me who I am, what's just happened, where I am, and how long I've been out of it.
Because you've had a lapse, you've had a time when you can't really remember, and that's really, really worrying, and that can be very difficult.
Recovery after a seizure isn't just taken as the first 5, 10, 15 minutes. It can often take a few hours or even days.
So why is it important that police officers can recognise seizures? The answer is so they know how to cope with somebody after they've had a seizure. So that they know that the worst thing you can do is to try and restrain somebody during a seizure and expect them to behave normally after a seizure. I think it's important that police officers, along with the general public, understand the nature of epilepsy and that they can recognise seizure types. It's going to be in their interest, and obviously in the public's interest, if they can identify the difference between a complex partial seizure and somebody who's under the influence of alcohol or drugs. Obviously, your response to both situations is going to be completely different. Most patients with epilepsy, if they're looked after during a seizure and after a seizure, will actually recover fairly soon and they won't present a problem.
Here are some things that may help you to recognise a focal seizure. Does the person smell of alcohol? Is there anyone with them that you can ask if they have a history of seizures? Can you see medical ID on them? If the answer to these questions is no, then ask yourself the following questions. Does the person seem confused? Are they unresponsive? Are they making repeated actions, such as chewing, crying out, or plucking at their clothes? Are they wandering off without knowing where they are going or what they are doing? Are they calmer if no one is physically close to them? If the answer to any or most of these questions is yes, it is very possible the person is having a focal seizure. First aid for a focal seizure. Speak to the person and be calmly reassuring. Gently lead the person to safety. Don't force or restrain them. Let the seizure run its course. Stay with them until their recovery is complete. Explain anything they may have missed. Don't act in a way that may frighten them. Don't assume they're aware of their actions. Don't give them anything to eat or drink. Don't attempt to bring them round. Don't place them face down on the floor due to risk of asphyxiation. Call an ambulance if, You know it's the person's first seizure. The seizure continues for more than 5 minutes. The person is injured. You believe the person needs urgent medical attention. So next time you see someone looking confused and behaving strangely, ask yourself the question, could they be having a focal seizure? Tonic-clonic seizures.
Those pictures are awful. They're not that bad, don't worry.
First aid.
What's that?
Someone help us.
Somebody call
Is there a
999.
first aider? Wait! What's going on?
Should we call an ambulance?
Hold her down.
What do you know what to do?
We could all help someone who is having a seizure. During a tonic-clonic seizure, the person goes stiff, loses consciousness, falls to the floor and begins to jerk or convulse. They may look a little blue around their mouth from irregular breathing. Don't panic, just take the appropriate action. Assess the situation. Are they in danger of injuring themselves? Remove any nearby objects that could cause injury. Cushion their head to protect them from head injury. Check the time. If the seizure lasts longer than 5 minutes, you should call an ambulance. Look for a medical bracelet or ID card. It may give you information about the person's seizures and what to do. Once the seizure is over, put them on their side in the recovery position. Stay with them and reassure them as they come round. Never restrain the person. Put something in their mouth or try to give them food or drink. It's not always necessary to call for medical assistance. Call an ambulance if you know it is a person's first seizure. The seizure lasts for more than 5 minutes. One seizure appears to follow another without the person gaining consciousness in between. The person is injured. You believe the person needs urgent medical attention. For more information about epilepsy, visit the Epilepsy Action website or call the Epilepsy Helpline on free phone 0808 800 50 50.